Okay, everybody. Today we have a very special guest, Kristina. She is the Shine Program Manager for Barnstable County. Welcome, Kristina.
Thank you so much, Kelly. I'm delighted to be here.
Yes. So first I want to start off by, what is Shine, if people don't have any knowledge of what is Shine?
Yes, so Shine is a statewide program here in Massachusetts, and Shine stands for Serving the Health Insurance Needs of Everyone. And the goal of Shine is to really provide unbiased, free insurance information for those folks who are turning 65 or who are 65 and either need or currently are on Medicare.
Awesome. So that's obviously very important, especially with the older population and open enrollment time coming up. So first I want to start off, we've seen a lot in the field that I work in regarding scams. So I just wanted to touch base with you because while I have you here, the perfect person to ask. What is something that people can look out for that, like information that would never come from Medicare? That where people could really identify as being a scam, number one.
Yeah, we've seen since the pandemic scams going up. I think I saw a statistic about 400%. So it's definitely an issue and definitely a problem for older folks and vulnerable populations. So, Medicare is never going to call you on the phone. Medicare is not going to send you a text message. So if you receive a phone call from Medicare or a text message, people asking for your personal health information, identifying information, never give out your Medicare number. Never give out your date of birth. Never give out your Social Security number. For me and my family, we actually have something set up with my mom that if she ever gets a phone call or a piece of mail or a text message, she needs to take a picture of it or forward it to myself or my brother. That's just an added kind of way to protect her interests.
Right.
There are stories out there of people losing even hundreds of thousands of dollars and life savings, and it's incredibly tragic and it's scary for folks.
Absolutely, and I think that is a great thing that you've done with your own mom is just show me, because it is, and it's evolving. It's becoming so high tech with the voices and the calls and the texts, and they're persistent. So just know Medicare's probably not going to call you or text you, or just think of how difficult it can be to get in touch with them. So
yes. And we have in Massachusetts, there's something called the Senior Medicare Patrol.
Okay.
And they're an organization that will investigate if you think you might have been scammed, or even if you have a question, because we all are kind of wondering if someone wants my information, I don't want to lose my health insurance. So they're a good resource to contact. So the Senior Medicare Patrol is there for folks if they run into any trouble or if they have any questions.
Yeah. So you mentioned that you did tell your mom to send you that information. So it sounds like you have a background, of knowledge to tell your mom that. So how did you get started with all of this? So tell us a little bit about yourself. How did you get where you are today?
Great. Well, thank you for asking. So I'm a licensed independent clinical social worker. I've been a social worker for over 30 years. I actually have both a bachelor's degree and a master's degree in social work. I'm one of those probably rare but very lucky people who knew early on what I wanted to do. I really wanted to be involved in a profession that allowed me to interact with people, to engage people, and to help people. So over 30 years, I've done a lot of different types of things. I've done individual clinical work as well as more macro program management, organizing, administrative work. I've worked in child welfare, in state government, also working for the National Association of Social Workers here in Massachusetts, and then spent good amount of time at Boston University School of Social Work. I still teach for BU online in their MSW
Awesome.
program, ethics and policy courses. So throughout my career, I've gone from that kind of individual to that more kind of macro policy level of interest and developed a real interest in health equity.
Absolutely.
So for the past couple years before coming to Shine, I was involved in a democracy organization, getting individuals to register to vote, using trusted messengers like social workers, doctors, nurses, to help folks use their voice
Right.
and vote, because
That's awesome.
so many of what happens in the medical room with a doctor is determined by the policies and the elected officials that are creating those policies. So after doing that work for a period of time, and I'm still very interested in making sure people are, registering to vote, I was looking around. The pandemic was a difficult time for a lot of people. I had been working remote for a long time and wanted to get back into being engaged in my local community, working with individuals. And when I saw serving the health insurance needs of everyone, that just resonated with me, given my
Absolutely.
experience as a social worker and my focus and real interest in health equity. And it's been great. This position is wonderful because it allows me to work with folks individually, doing counseling, talking to individuals about their own health insurance needs, as well as coming out into the community. I get to travel
Right.
across the Cape and the islands and meet with councils on aging, senior centers, other local community organizations to talk about what's available for folks once they turn 65, or for folks who are disabled and under 65, because Medicare is also available to some of those folks too.
Absolutely, because the entire, process of Medicare can just completely overwhelm
Yes.
people,
Yes.
so it's nice to just help on a bigger scale, but then on a smaller scale itself where, it's going to be okay, we're going to get through this, we're going to help you with any questions you have, we're going to help you enroll, and that's really the goal of Shine, is to get individuals the service that they need, right?
Yeah, there's so much information out there that's very confusing, and Medicare is kind of a web. And,
Right.
We talk to people all the time who say, I'm a fairly intelligent person and I don't understand this.
Right.
Or they see a commercial on TV with Joe Namath. I actually saw one with Big Papi the other day. And they're like, oh, I want that, what they're selling.
Right.
And that may not be the best plan for you, or it may include a network of doctors that aren't here on Cape Cod. Once you cross that bridge,
Right.
it's different on Cape Cod, and there isn't as much
Yes.
access to medical care as there is.
My grandmother experienced the same thing, where she saw a commercial on the nightly news, and she was so excited, and then she got a piece of mail, and she was thinking this was the next best thing to add to her Medicare, and she was going to get dental and vision coverage, and life was going to be complete. In the process of filling out the paper, and I luckily got it and I read it, and when I did, I realized it was going to cancel out
Yes.
her Medicare.
Yes.
So by signing the paperwork, it wasn't adding anything to it; it was
Right.
getting rid of it.
Yeah.
But because she had saw it on the night, on the TV, and got the mail, she thought it was real. It was
Right.
going to give her. So I think having some people out there in the community can help maybe point in the direction that maybe that's not the route you want to go, or
Yes.
this is what that is, and
Yes.
all the different parts. It's confusing.
Yes, and we're very lucky here on Cape Cod. We have about 73 certified Shine counselors across the Cape. Most of them are located at our councils on aging, as well as some community-based organizations. So these are your neighbors. These are other folks who live in your town, who volunteer their time.
Right.
And I will say it's not easy to become a Shine counselor. You have to go through 40 hours of training.
Okay.
you have to take a test, which is open book, thank goodness. But it's an 80-question test. And then you have to be recertified every year. So these are folks who are very committed. They volunteer their time to do the training, to take the test, to continue to keep up their knowledge, as well as meeting with individuals. And most appointments take about an hour to go through the information. You know, we couldn't do this without the volunteers that we have, so we're always looking for new volunteers, but we're very grateful for the volunteers that we have, and again, couldn't do it without our 73 certified volunteers across the Cape and the Islands.
And then what you do is you partner with different agencies and get the volunteers into the agencies?
Yeah, so most of the councils on aging actually have volunteers there. So if you are about to turn 65 or if you currently have Medicare, you can always call your local senior center or council on aging and see if there's a Shine counselor available or an appointment open and go, because if there's a window of time right before you turn 65, you have a 7-month period. So it's 3 months before your birthday, it's the birthday month, and it's 3 months after your birthday. So that's when you have to sign up for Medicare. If you're already collecting Social Security, that happens automatically. But most folks, when they turn 65, might still be working. And if you are working, you can keep your employer group health insurance if you work for an employer. See, it's already getting, the web's starting to weave, right? But if you work for a large employer over 20, you can keep that employer health insurance. Otherwise, you might want to sign up for Medicare. And there's parts A, B, C, D, but our licensed or our certified counselors get into all of those details to make sure that you have the coverage that is going to match your budget as well as meet your medical needs.
Right, what's best for them. And I think that's what you were speaking to with the training of the individuals.
Yes.
And it's good that they're in the community, they might know what you need. So if somebody's watching and they're thinking, oh my goodness, I might have some questions, you suggest that they call up their local center and just see what's available to them.
Yes, and they can also call the county office. Barnstable County actually administers the Shine program for Cape Cod and the islands. And myself and my colleague, Bill Redman, who is wonderful, he's our project specialist, work for the county. Our phone number is 508-375-6762. You can also call the county and we can either meet with you in Barnstable Village where our office is located or direct you to your local senior center, because depending on where you are on the Cape, Barnstable may not be convenient for you to get to, so we can plug you into your own local area.
Yeah, and when I was talking to you earlier, what you mentioned something about how when you guys, the volunteers are training, you guys almost do like a role playing. You work on difficult cases. So if you're sitting at home and you may be watching this thinking, you know, maybe I dropped the ball, or I've gotten myself into a real big mess, or I might not want to call. That's okay. You know, you guys work and you practice and you try and figure out cases that may be difficult or...
Yeah, we have, again, our counselors are very experienced. I started in my position about 4 or 5 months ago, so I don't have that depth and breadth of knowledge that some of our folks have. So we use one another for consultation. We also have the state office, because the state of Massachusetts and the federal government fund the Shine program, as well as other community programs and grants. But as part of our training and certification process, our counselors that have been doing it for a while mentor the newer counselors. So we actually just graduated a new class of 15 newly. So I was actually one of those graduates.
Well, congratulations!
Thank you.
You've accomplished so much in your career, and you're still blossoming.
Well, there's so much to learn still, and I think it's our own personal experiences sometimes draw us in, and I think dealing with my own health insurance, the insurance for my parents, making sure everybody gets their needs. You want to be able to help other people, because when you're sick, or if you have a chronic illness or a new really scary diagnosis, you don't want to have to worry about, am I going to be able to afford my groceries this week, or am I going to be able to afford my rent? We're all experiencing inflation. We're all experiencing kind of what's going on in our times. And so, we don't want to get any surprise medical bills. We want to make sure that we're able to get the medication we need. One of the things that I've seen is, folks, when they retire, they've budgeted and they have planned out what their monthly income's going to be. But maybe they haven't been feeling well, they go to the doctors and they get a new diagnosis and they have a medication that they didn't plan for. And the copay of the medication may be, those medications you see on TV, everybody, they look like they're really helpful, but they can be very expensive. So sometimes that may not be in your budget. So Shine counts, to get to your point earlier, if you have medications and you're paying a lot for your medications, open enrollment is actually the perfect time, which is between October 15th and December 9th, to meet with a Shine counselor, because what we do is we can sit with you, you bring your medication list, we can go into Medicare.gov and plug in your medicines and see if you have the best plan that's going to be the most cost effective for you. So this is now the perfect time for those individuals who currently have Medicare to get your Medicare card out, to write up your drug list and make an appointment for open enrollment, because that way we can make sure that you've got the best coverage and most cost-effective coverage possible.
Right, so even if you're sitting at home and you're thinking, well, I'm way past 65, or I got this all figured out, it might be wise to just do what you're saying, to do a review, to make sure that you're still falling in the best plans possible, the best brackets, because things are changing all the time. So just might having a little check-in is wise.
Yes, those premiums change every year. So it is very important to double check and make sure that your coverage is meeting your pocketbook and your checkbook. So it is very important.
Awesome. That's a good tip, because I would have thought, you're enrolled, you're good to go, don't worry. If it's working, don't mess with anything. But I think that's a great thing to know, to stay on top of it and review everything as best as possible.
Yes, absolutely.
Awesome. So open enrollment's coming up. What else do we have? Does Shine have what is going on in your worlds that we need to know?
Yeah, so we're preparing for open enrollment. But one of the other things we're doing, and that is when we double check your drug lists and Part D plan, and making sure that you have the right drug coverage. The other thing that's coming up is that during that period of open enrollment, we don't want to lose anybody who's turning 65. So many of the councils on aging and senior centers are going to be holding Shine birthday parties. So if you're turning 65 between September and December, we're going to have an event at the local councils on aging and senior centers where you can come and hear like a Medicare 101 presentation. So myself and other volunteers and staff will be traveling around the Cape. So keep an eye out for your local COA newsletters, or just call your council on aging to see if there's a Shine birthday party coming up. There may be cake, there may be cupcakes, we don't know. I'm not going to wear a party hat or anything, but we want to make sure that people still know the good information up front when they turn 65, so they can, have that information. So we're going to do these presentations to capture those folks, because during open enrollment we're very busy, and we're trying to get as many people in as possible.
Absolutely, and just some frequently asked questions, I'm assuming. You know what I mean? I feel as a lot of people probably are wondering the same questions, but they're probably a little too nervous to ask, because they might think, oh, that's a stupid question, I don't want to ask. But this is a perfect opportunity. The Shine, birthday party's coming up, you know?
Yes.
That's exciting. So I had a question, and I know it's probably a silly question, but I sometimes still get confused on the difference between Medicare and Medicaid. So if you could just break it down a little bit, I think it could help a little.
Yes. Well, let me tell you, Kelly, a lot of folks get confused between Medicare and Medicaid, and sometimes I even need to use my little cheat sheets to understand myself.
Okay,
so
feel
you're
better.
in good company, yes. So Medicaid, both are federal programs, but Medicaid is what comes to the states, and that is for individuals, and in Massachusetts it's also called Mass Health. So those are individuals who meet a certain level of the federal poverty standard. Those can be folks who are 65 and under or 65 and older. Medicare is only for folks who are 65 and older. However, some folks, when you're on Medicare, can be dually eligible for Mass Health, which is Medicaid, as well as Medicare, based on your income and your assets. So as Shine counselors, if you come to meet with a Shine counselor and you're turning 65 or you're already 65, we will screen you for your eligibility for Mass Health to see if you might be dual eligible. You could qualify for Mass Health. You could also qualify if your income's a little higher or your assets are higher for what we call buy-in programs. So it's very confusing.
Right.
But when you think about Mass Health, kids can be on Mass Health, families can be on Mass Health. And one of the things that's been going on now, it started in April and it's going to be going until April of 2024, is what they're calling the Medicaid unwinding. And that means that during the public health emergency for the past 3 years during the pandemic, folks were allowed to stay on their Mass Health if they had it. So if they turned 65 and were on Mass Health during the pandemic, you stayed on Mass Health. So what's happening now is the public health emergency is over, so Mass Health is catching up with all of that. And they're sending out blue envelopes. So if you receive a blue envelope in the mail, don't put it aside, open it right away. Because you have, I think it's about 90 days to complete the information to see if you still qualify for Mass Health. So we're starting to get a lot of calls right now of folks saying, I just lost my Mass Health, I'm over 65, what do I do? The good news is it opens up a special enrollment period window so you can apply for Medicare. And if you don't qualify for Mass Health kind of as it is, there may be another buy-in program that can pay for your premiums and even some of your co-pays. So again, it's complicated information. It can be really off-putting for some people, but the important news is that the Shine counselors are there to help you.
Right.
Even if you don't receive a blue envelope in the mail, anytime you go for a Shine appointment, if you're turning 65, we screen you for any state programs that might kind of supplement the Medicare. And again, that's by paying for premiums or any other kind of co-pays or co-insurance. So
you can point the individual in the direction of where they might need to go.
Yeah.
So it's always just important to call, make a Shine appointment, and if Shine might not be the need or Medicare, there will be resources out there that the Shine representative can definitely help direct the individual for.
Yes, and I want to be clear, if you received a blue envelope and you're under 65 or you have children, you should contact the Cape Cod Community Action Program because they can work with that population. But if you're over 65 and received a blue envelope, you want to call Shine.
Okay, well, that's some great information. I'm very happy that you came to join us. And overall, is there anything else that you'd like to tell us about Shine? Any impactful stories or anything that you'd like the public to know that keeps you going or moving forward?
Well, every day is different.
Yes.
Some days I'm able to meet with folks or talk to folks over the phone. And that's when you feel like you're really making a difference and touching lives, which is, kind of why we get into this
yes,
work.
Absolutely.
And then, as I've traveled around the Cape, it's been so interesting to learn about the different individual communities and then to understand the needs of individuals as they're living here on Cape Cod and the islands. And then to think about some of the policy issues and the things that, are the decisions that are being made, kind of going back to my health equity and voting rights work and how important it is for folks to be engaged. So going to, their senior centers, going to the yoga classes or even saying, you know what, I think I might want to volunteer because, I want to get out a little bit more, feeling kind of isolated. And even though Medicare, as we said, is kind of a web, it's a great group of people who really care about one another, who care about their communities, and really kind of get into this stuff. So we're really open to volunteers and want to welcome anybody who might have an interest in volunteering for Shine. We need counselors all over Cape Cod and the islands. And
we can link that information if how people can find out more about.
Oh, great.
Yes, absolutely.
Yeah. So, no, I mean, it's a very rewarding program. And again, I just also want to stress our volunteers are amazing and we couldn't do it without them. So we're really grateful for everyone who's come forward.
Yes, thank you to the volunteers.
Yeah, and grateful for folks like you, Kelly, for inviting us out to spread the word. This is a program that is nationwide, and I don't think a lot of people, I didn't know about it until a year ago. So hopefully some new folks are hearing about it for the first time, and if it's appropriate, taking advantage of our services, because we're here to help and we really want to help folks save some money and get the care and the coverage that they need.
Yes, well, we will see everybody at the birthday party at their COA. And thank you very much, Kristina, for joining us and all of your wonderful knowledge and help that you're providing for the community.
Oh, great. Thank you so much.
You're welcome.